Good morning, everyone. Thank you and welcome to the Public Health and Minority Health Disparities Subcommittee. It is March the 30th, and we have a lot of bills on the list today. So we're gonna jump right in because I know we've all got a long day ahead of us. The first bill we're going to go to is House Bill 354, Senate Bill 343, the Maryland Achieving Better Life Experience ABLE program. We had discussion on this bill last week. As a reminder to members, this is getting us compliant with the changes in federal law, and it passed. The Senate bill passed the Senate 45-0. Erin, if you can walk us through one more time, and then we'll have a motion.
Sure. As Delegate Bagnall mentioned, the bill conforms Maryland law to Internal Revenue Service regulations governing the ABLE programs by specifying the conditions under which a Maryland ABLE program account may be opened by and distributions made to individuals other than the eligible individual. The bill would provide that if the eligible individual is unable to establish the account, that individual's agent under power of attorney may establish the account. Also, if the eligible individual does not have a power of attorney, in priority or order, an ABLE account may be opened by the individual's conservator, legal guardian, spouse, parent, sibling, grandparent, or representative payee appointed by the Social Security Administration. Minors or individuals against whom the eligible individual has opened a peace or protective order, an individual held civilly or criminally liable for financial exploitation, or an individual who is subject of a civil or criminal order prohibiting contact with the eligible individual may not establish an ABLE account. There is also a provision that the Maryland 529 board may accept a certification made under penalties of perjury from the person seeking to establish an ABLE account that indicates the basis of the person's authority to establish that account and that there is no other person with a higher priority to establish the account.
Thank you. There is an amendment for the House bill, which would conform it to the Senate bill. So let's start with House Bill 354. And Erin, if you can just explain the amendment.
The amendment is just a change to the effective date. So the Senate bill was amended to go from an October 1st, 2023 effective date to June 1st, 2023. So the House bill would be amended to also be a June 1st effective date.
Thank you very much.
Move the amendment, Madam Chair.
Second.
All right, amendment has been moved and seconded. Any discussion? All in favor, say aye. Anyone opposed, go ahead and raise your hand. All right, on the bill
amended, and the Senate bill as well, moving both.
So we have a motion on House Bill 354 as amended and Senate Bill 343. Do we have a second?
Second.
All right, both have been moved and seconded. Any discussion? All in favor, say aye.
Aye.
Okay. Anyone opposed, go ahead and raise your hand.
Move the bill.
Both bills have been moved and seconded. Once again, all in favor, say aye. Anyone opposed? Thank you. Both bills pass unanimously. Thank you, everyone, for all your work on this. We're going to go to House Bill 1155. This is the work group on establishing a youth co-designed integrated behavioral health model. Once again, we had this for discussion last week, but we held the bill because we still were working on getting consensus. My understanding is that we have consensus. So Erin, if you can give us an update on this bill as well.
So there has been a reprint provided for the bill. If you recall last week, there was just an issue over who would staff the work group. MDH has agreed to staff the work group. But if you look on page 3 of the reprint, there is a requirement that the work group develop a plan for implementing a youth co-design integrated healthcare pilot program. Under the bill as introduced, that would have to begin before July 1st, 2024. That's been pushed out to July 1st, 2025. And then also the report of the work group in the bill as introduced was December 1st, 2023, and that would be pushed out to December 1st, 2024.
The amendment.
Do we have a second?
Second.
All right, amendment's been moved and seconded. Any discussion? All in favor, say aye. Aye. Anyone opposed? All right, do we have a motion on the bill as amended?
Move the bill as amended.
Second.
All right, it's been moved and seconded. Any discussion? All in favor, say aye. Anyone opposed? Go ahead and raise your hand. All right, it passes unanimously. Thank you, everyone. As you know, your subcommittee chair is a big fan of that particular bill, but I don't have favorites. All right, thank you. We're going to go ahead and move to House Bill 319, pesticide registration, PFAS testing requirements. You should have a reprint of this bill. And Aaron, if you can walk us through the bill as it has changed in the consensus that we have.
Yes. So there is a reprint of the bill. The bill has been amended into a study. So if you look on the reprint, the Department of Agriculture, in consultation with the Department of the Environment, MDH, and the U.S. Environmental Protection Agency, will study the use of PFAS in pesticides in the state. The study must include an analysis of the health and environmental aspects of PFAS in pesticides in the state, the identification of testing methods capable of testing for PFAS in pesticides, an examination of characteristics that distinguish testing methods for PFAS that are validated for drinking water from testing methods that are validated for pesticides, a status update on federal efforts to certify a method for testing for PFAS and pesticides, and a status update on state and federal efforts to regulate or ban the use of pesticides containing PFAS. On or before December 1st, 2023, the Department of Agriculture must report its recommendations and findings to Senate EEE and HGO.
Thank you very much. And this conforms the House bill to the Senate bill, which did pass unanimously, Senate Bill 158. So if I could have a motion.
Move the amendments.
Thank you. So I have a second. All right, it's been moved and seconded. Any discussion? All in favor, say aye. Anyone opposed? Go ahead and raise your hand in the chat. All right, do we have a motion on the bill?
Move the bill as amended.
Do I have a second?
Second.
Thank you. It's been moved and seconded. Any discussion? All in favor, say aye. Anyone opposed? Go ahead and raise your hand. Thank you. This bill passes unanimously. We are moving right along. House Bill 681, Senate Bill 558, Recovery Residence Grant Program established. Aaron, if you can walk us through the bill.
So this bill would establish a recovery residence grant program within MDH to award competitive grants to recovery residences to support operations, services, and programs. It requires the department to establish certain procedures, and it requires each year the governor to include $500,000 in the program for fiscal years 2024 to 2027. Under the bill has introduced required these grants to only be provided to level 2 recovery residences. The Senate amendments expand that population to include level 1, level 2, and level 3 recovery residences. It repeals some of the requirements that those residences demonstrate that they have been operating for the immediately preceding 5 years, or maintain a zero tolerance policy regarding substance and alcohol abuse, or serve as a residence for a minimum of 10 individuals per day and 30 individuals per year. So it takes away some of the specific requirements and instead requires that they meet any other requirement that's established by MDH and regulation.
Thank you. And just to clarify, we do need to adopt the House, we do need to adopt the Senate amendment onto the House bill. So let's go ahead and move the amendment, and then we'll open it up for discussion.
Move the amendment.
Second.
All right, it's been moved and seconded. Delegate Chisholm.
Can somebody give me a brief description between the difference between a level 1, a level 2, and a level 3? Doesn't have to be scientific, but just so I have a better idea.
Am I permitted to speak, Madam Chair?
Yes, go ahead, Mr. Pico.
Thank you. So levels, it's structure driven. So level 1 is a peer run facility, democratically run. It's basically a house. The individual in recovery, that person uses his house. Level 2 is more structured. It's monitored. It has policies and procedures. that are generally acceptable. They have to be certified by the National Alliance of Residences for certain standards. And level 3 is supervised and it's clinically driven. But it only applies to those residences that are nonprofits and that are that do not accept insurance. So it's structure driven, Delegate Chisholm.
So a level 1's like, let's say, my house, and I'm helping fellows, and then level 3 is like a Tranquility Woods, I believe. Tranquility Woods, I don't know if you're familiar with them, but it's very high level. Okay, so we're now including all 3. So I'm correct on that, Madam Chair?
Yes. Yes, sir. These amendments were suggested by the Maryland Department of Health. And
Okay.
if I may use the lady's name, Ann Seacott represents some of these programs, and she suggested the same amendment.
Okay, thank you. I appreciate the explanation.
Yes, sir.
Thank you, Delegate Chisholm. Delegate Hill.
Thank you, Madam Chair. So I assume, but I would like to hear, what is the arrangement? Is it in the budget? Is it promised? Did we have a letter? What's the story?
Aaron, do you want to speak to that?
So we would, well, first of all, we'd have to run this by appropriations for approval, because it's over $100,000 threshold. I can find out, I think it is, and there might be people on this call, but I do think that there already is money for at least next year or this
And
year.
we've got Marie Grant on the call, raising her hand, so she might be able to give us some information on that.
Thanks, Delia Bagnall. Yes, Delegate Hill, there is, at least in the Senate version of the budget as passed, there is an appropriation for FY 2024 specifically for this bill.
All right, thank you.
Thank you. Thank you for the question. Any further discussion? All right, all in favor of the amendment, say aye. Anyone opposed? Thank you. If we can have a motion on.
Move the bill.
Second.
Been moved and seconded. So this is both House Bill 681 as amended, Senate Bill 558. Any further discussion? All in favor, say aye. Anyone opposed? Go ahead and raise your hand. Both bills passed unanimously. Thank you so much, everyone. All right, we are going to go to Senate Bill 154. This is Public Health, Mental Health Advanced Directives Awareness and Statewide Database. There is no cross-file on this bill. There are no amendments. Once again, this bill passed the Senate 45-0. And
Move the bill.
Aaron, do you want to speak to this bill? Are you good with moving it?
Do you want to know what it does?
It creates an advanced directive. All right, it's been
I'll be
moved.
fast.
You got a second?
Second.
All right, it's been moved and seconded. Thank you. Any further discussion? All right, Delegate Chisholm.
For the good of the public, can we know what it does?
Absolutely. Aaron, if you could go ahead and walk us through the bill.
Yes.
Thank you, Delegate Chisholm.
The bill requires MDH to develop and implement a public awareness campaign to encourage the use of mental health advanced directives in the state. It also requires the Behavioral Health Administration and MHCC jointly to study how first responders and behavioral health crisis providers can access a certain advanced directive database when responding to a behavioral health crisis, and to report to certain committees of the General Assembly on their findings.
Thank you very much, Aaron.
Thank you.
Thank you. I appreciate both the efforts at efficacy and balancing the public good and public awareness. So we have a motion on the bill. All in favor, please say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, once again, that bill passes unanimously. All right, we are cranking along. We're going to go to Senate Bill 626, Health Services Cost Review Commission members appointment. This is another bill that does not have a cross-file. It passed the Senate 44-0. And Aaron, if you can go ahead and tell us, walk us through the bill.
The bill would require the HSCRC commission members to be appointed with the advice and consent of the Senate. Currently, they are not.
Move the bill.
Do I have a second?
Second.
All right, bill has been moved and seconded. Any further discussion? All right, all in favor, say aye. Anyone opposed, go ahead and raise your hand. This bill passes unanimously. Thank you so much. We are going to go to Senate Bill 732, Department of Disabilities State Coordinator for Autism Strategy and Maryland Commission on Disabilities alterations. Once again, this bill does not have a cross file. It did pass the Senate 45-0. And Aaron, if you can walk us through the bill. And I think this is the one where we also need to adopt an amendment as well, correct? Okay.
Yes, I'll discuss both. This is a departmental bill. It transfers the state coordinator for autism strategy to the Department of Disabilities. It alters the staffing of the advisory stakeholder group on autism related needs. And it alters the membership of the Maryland Commission on Disabilities to add one individual with a traumatic brain injury. Our fiscal staff at DLS recommended an amendment that would just clarify that the governor would be required to transfer one position and $131,275 in general funds for the state coordinator for autism strategy that's currently in the governor's office of community initiatives from it would be transferred to the Department of Disability. So it's just clarifying the position, and the amount of money associated with that position would have to go to a different budget. So that would be an amendment to the bill.
So let's go ahead and move the amendment, and then we'll open it up for discussion. Can I have a motion on the amendment?
Second.
All right, it's been moved and seconded. Delegate Chisholm.
Thank you, Madam Chair. So we looked at a bill, I don't know, a week ago, 2 weeks ago, 2 months ago. And in the budget, we moved that $20 million from autism over to more of a general fund. Does that work in conjunction with this bill? Is that why? I'm just trying to understand.
That's different. That's about the autism waiver program, and then the other community and home and community-based services waiver programs and the wait list.
Okay,
And
so
that's a separate issue.
So moving this into underneath of DDA is
DOD. It's going to disabilities. So it's a current position that's currently in the governor's office of community initiatives is where this autism strategy coordinator is located. And it's just moving that pin to Department of Disabilities.
And that's based on their recommendation.
Correct. It's a departmental bill, and they should be on the call if they want to speak to it.
Okay. I just wanted to make sure I knew why we were.
They want to do it. Yeah.
Yeah, we actually have Elizabeth Hall on the call. Do you want to go ahead and speak to this bill?
Yeah, I'd be happy to. So yes, this is our departmental. The amendment, it might not be necessary to do that amendment, because in the larger in the section that's from in the statute, there is funding language already there.
Could I show it to you? So when we've moved positions before, we've done the same thing. So it's just moving that budget line item from the current, where it's located now in the governor's office of community initiatives to DOD's budget.
Would that be in the statute, or?
I'll show, it's special section language. We've done it before when we've moved other pins,
Okay.
and I can show you
Okay.
other examples.
Thank
But we
you.
ran
No,
it
I
by
just-
our budget analysts and everyone at DLS.
Okay, thank you.
So we have a motion on the amendment. It's been moved and seconded. Any further discussion on the amendment? All in favor, say aye. Anyone opposed, go ahead and raise your hand. Can I have a motion on the bill as amended?
Move the bill as amended.
Do I have a second?
Second.
Second.
It's been moved and seconded. Any further discussion? All in favor, say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, that passes unanimously. Thank you once again, and thank you for the clarifying questions, and for the department. Thank you for being on the call. We have one more bill on the list today. We are only going to be discussing this bill. We're going to get an update on it, but my understanding is we don't yet have consensus. So this is House Bill 876, Senate Bill 644 Maternal Mortality Review Program, local teams, access to information and records. Aaron, if you can walk us through the bills, and we'll have the discussion, but we're not going to vote this bill today. Aaron, you're on mute.
Madam Chair,
Yes, Delegate Hutchinson.
could you just repeat the bill number again, please?
Sure. It's House Bill 876, Senate Bill 644.
Thank you.
Okay, so this bill alters the information to which a local maternal mortality review team is to be provided access on the request of the chair of the team. And it requires that a local team be provided immediate access to requested information and records, including information on prenatal care maintained by a healthcare provider regarding a woman whose death is reviewed by the local team.
Thank you. And is there anyone who, let me start with Pam Casemeyer to give us an update on where we are and sort of the sticking points on some of the language. And then I see we have Baltimore City Health Department is here as well, or Baltimore County. I'm sorry, BCHD. Julia Roche. We'll go to you in just a moment. Go ahead, Ms. Casemeyer.
Yes, and I'm representing ACOG on this particular issue, and we are certainly supportive of the local teams being able to get access to the medical records. But we think that there's some additional language that is included in the state maternal mortality program related to record disclosure that should be included in this language. We think it actually will help the department get the information it needs and that use it appropriately. There's some cross references to some other sections related to medical records review that is included in the state program so that the local program would align with the record access for the state program, not through their data use agreement, getting the records directly, but the language itself isn't clear enough to ensure those protections and that access is there. So we are talking with the city. We had a call yesterday and we'll continue to work on the language to make sure they're able to have direct access to records, but that the appropriate safeguards on record review and privacy and retention and all of that is reflected in these amendments as they are for the state program. I know that the original bill was based on the child fatality review framework, but there's some references in that program record release issues that aren't reflected in this bill. So it's almost more a cleanup so we can be sure that locals can get the records directly, but in a way that is aligned with how records are released in the state program, and then the locals would have direct access as well.
Thank you, Ms. Casemeyer. And Delegate Chisholm, did that answer your question? I saw your hand go up and come back down.
Ms. Casemeyer did an outstanding job answering my question.
Thank you. All right, Ms. Roche, and then I think we have Ms. Ifikache on the call too, if you would like to be heard on this bill. Ms. Roche, go ahead.
Hi, good morning, everyone. My name is Julia Roche. I am the Legislative Affairs Director with the Baltimore City Health Department. So the C, it is the city, but I recognize that might be confusing. I am actually going to pass it over to my colleague, Nina Themelis. She is Interim Director with the Mayor's Office of Government Relations here at the city. And I think she will do an excellent job kind of clarifying where we're coming from in looking to get these records directly. So thank you, Nina, and thank you, everyone.
Good morning. So Nina Themelis with Baltimore City. The root issue that we're trying to solve here is being able to access the records directly. We've had to cancel multiple convenings of our maternal mortality review team because we have had either a lack of access to records or incomplete records. And the reason that we're asking for immediate access is that the city has only provided the notification that a maternal death has occurred after the state has concluded its entire review. So the immediate access would follow the due diligence that the state has already completed and would not further delay the city's ability to access those records and be able to perform its review so that then we can be proactive in the way that we engage with our constituents to try and prevent future deaths. We also, I believe, have Rebecca Deneen on the line from the City Health Department in case there are any more technical questions to be answered.
Okay, thank you, Ms. Demolis. Ms. Ifikache, did you want to be heard on this bill as well?
Thank you, Madam Chairman. Only to say, and I will just for the record, Delora Ifikache representing the Maryland Hospital Association. Ms. Casemeyer did put together some very reasonable amendments that we did present to the health department. However, we weren't able to get to a substantive discussion. So I don't know if that might happen in the future, but it would be great if we were able to do that. Unfortunately, that did not happen yesterday when we attempted to do so. So that's where we are currently with the amendments.
Thank you very much. And I appreciate we are as everyone on this Zoom knows, we are in very time sensitive with 12 days, 11 days remaining. We'll call it 10. So I strongly encourage the stakeholders to meet and come to some consensus. We are going to hold this bill today to give you a little bit of time, but I would really love to have some sort of consensus by beginning of next week so that we can move these bills, because this is really important work that needs to be done. Is there anyone else who would like to be heard on this bill before we adjourn? Because this is our final bill for the day. Any questions from the members while we still have our stakeholders here?
Yes, I have a question, Madam Chair.
Go ahead. I can't see who that is.
It's Tiffany.
Oh, thank you. Thank you, Delegate Alston. Go ahead.
Yeah, so I want to know what language is in the other bill that allows the state to have full access, and can we not just move that language over?
Well, sorry.
Ms. Casemeyer, go ahead.
I'm sorry, I didn't raise my hand. There is some language that says that health care providers shall provide, and that was the language we had included in our amendment that said that they could add that, and then it has an additional section in the code that deals with medical record privacy related issues a bit in terms of disclosure and protecting both the provider and the city for the sharing of those records. So that was the piece that we wanted to add to this bill to be sure it was clear, and that the requirement for providers to provide records to the local teams was analogous to their requirement to provide it to the state team.
Thank you, Ms. Casemeyer. Ms. Roche, go ahead. Oh, sorry, Delegate Alston, you had a follow-up?
Yeah, so if that's the only sticking point, can we just agree in concept to that amendment and let staff work out the language so we can move this?
Aaron, do we think we could consider that in concept?
I can certainly draft something.
Thank you. Ms. Roche, and then we'll go back to the members.
Thank you. I do appreciate it. I realize you are all quite busy. I did just want to note that we actually did come up with and propose some language that we think would be a good compromise. Unfortunately, we got our wires crossed, and I don't know that made that to Ms. Ifikache and Ms. Casemeyer prior to our meeting yesterday. But what we think might work would be changing it to say promptly with no undue delay, because we do understand our thinking was that the child fatality review, their statute uses the word immediate. So we're coming at this from a place of wanting to be consistent with the other fatality reviews. I understand that the Maryland Hospital Association is looking at this and trying to be consistent with the state's statute. So we're both trying to be consistent, just with different things. So we thought that an amendment that would solve our problem and perhaps address the Maryland Hospital Association's concerns would be amending the language to promptly with no undue delay. And again, we conduct our review. So we are the only local team in the state. We're sort of trailblazing in this area. And we do conduct our review only after the state has already conducted their review. That would not change. We're just looking to get these records more quickly, still not, of course, following all of the necessary protocols, but we're just really trying to address the issue of maternal mortality. We all know that Black women experience disproportionate rates of maternal morbidity and mortality. Baltimore is a majority Black city. We're really trying to do right by our constituents here. So yes, like I said, perhaps we can consider the language of promptly with no undue delay.
And thank you. And Ms. Casemeyer. So
Yeah, and for us, it's not how quickly they get them. This is the first I heard that they thought the records were going to be coming from the state, because we had understood they wanted the providers to provide the records, which is what happens under the Child Fatality Review Committee process. Is it comes from the providers to the program. The bill is drafted doesn't say the records come from the state. I do think there is still that reference to the one section of the medical record statute that might need to be added. We did not get the alternative amendments from the city, so we haven't been able to look at them, which is why I think, it's in terms of Delegate Alston's question, unfortunately, in this kind of issue, the devil's a little bit in the details, even though everybody's objective is the same, is to make sure the locals have quick access to the records for their work as well.
and understood. I appreciate that. Delegate Hill.
So I'm sort of in agreement with Delegate Austin that we ought to be able to work this out now and not have to hold this bill. So what I think I hear Ms. Casemeyer saying is that there are two parts to this. There may, the language that Ms. Roach is suggesting may be adequate, but there needs to be additional language clarifying from who the records are being requested. Is that right, Ms. Casemeyer?
Whoops, from who they're being requested, and also I don't know how to describe it exactly. There's a section that refers to a particular provision in the medical records law that talks about the protections of the records that are shared back and forth, because you have limitations on disclosure of records. And this basically says those sections of the law wouldn't apply. So that's a piece of it we really hadn't talked about, but isn't in the bill, that we would need to look at as well, which actually benefits the city and everyone else. So there's a little bit of extra language too that would have to be talked about.
So Ms. Roach, if I can may, Madam Chair.
Yep, go ahead.
Whose records are you all actually trying to get? So, just so the committee's clear, and then we can see if there's language that needs to be, are you talking about from the providers? Or are you talking about from the state? Whose records
Yes.
are the city?
Thank you for asking that, Delegate. I appreciate it, because I think I may have unintentionally been confusing. We don't get the records from the state. We do get the records directly from the provider, or rather, sorry, we're looking to get the records directly from the providers. And perhaps if it is all right, Rebecca Deneen, our Assistant Commissioner of Maternal and Child Health, she can really, I think, clarify that process for you.
And do you understand what the current statute says about how quickly providers are required to turn over records?
Yes, although we've unfortunately been experiencing challenges with.
Understood. I understand that I understood that from the hearing, and that's why this bill is here. So then my question would be, is the problem that the language that the current statutes are not swift enough, or is the problem that you think for your purposes, providers have to have a higher standard than what they normally are required to do? Or is this an enforcement issue that they're already obligated to get them to whoever requests medical records within a time that would be suitable for your purposes? They're just not doing it.
That is an excellent question. And if it's all right, I am actually going to ask Assistant Commissioner Deneen to respond to that.
Sure. Thank you, Julia, for allowing me to speak. Delegate, the issue is that we are just trying to get an independent ability, as we have with child fatality review, fetal and infant mortality review, the ability to abstract records from providers directly without any difference from what we do in these other review processes. When we have to do things through the state, the way that we had originally set up, we had written this original bill, and this got disrupted the last time we wrote this bill, and this amendment was made that we could not get the records directly. There was just no, this got caught up the last time. So the whole purpose of this amendment is just to allow us to have the independent ability to abstract the records ourselves and conduct a review locally. That is a hyper-local review, allowing us to fix our systems. This is not a complicated bill. I'm not sure why we need to add more language. This is a very simple change of just wanting to get direct access to records, which I think anybody would agree is an important thing if we've got a high maternal mortality rate and are trying to prevent these maternal deaths.
Yeah. Madam Chair, may I continue?
Yes, this is the time for this discussion. I don't think we're going to be ready to move this bill, but I want to have a full discussion so that we're getting all of our questions out and getting clarity for the committee. So go ahead.
So I guess what I'm saying is, if that's the goal, and I think everyone's clear about that, then why do we have to play with the immediate access? It sounds like what you're really trying to do is be able to request the records directly from the providers, and that the current statutes by which providers have to provide records upon request would be sufficient. I mean, basically, you want to be able to, subpoena or send a medical records request and have it responded to in the same way it would for these other things. So the issue doesn't seem to be about immediate access or without due delay or any of that stuff, because it sounds like there are already things that I guess Ms. Casemeyer might be able to comment on that.
Yeah, I'm not sure why Ms. Casemeyer has brought these things up. There was no issue with any of our other bills. It feels like it came up to us at 4:30 yesterday. So we had never heard this.
No, that's not what I'm saying.
Okay.
I'm saying I understand what she's saying, and I understand what you're saying, and I don't think you're hearing each other. And so I'm not sure that when I'm reading this bill and I see this immediate access and you offered some alternative language to that, that's not, it doesn't sound like the access timing is what needs to be addressed. You just want to know that you can petition directly to the provider. All right, I'm done.
Thank you, Delegate Hill. And very, very respectfully, the concerns that Ms. Casemeyer brought up were also reflective of some of the concerns of the members. So Ms. Casemeyer, go ahead, and then we'll go to Delegate Alston, followed by Ms. Krinky.
Yeah, and I'd like Ms. Krinky, I'm glad you're going to let her speak as well, because the local hospitals in Baltimore City had these concerns. And I want to reiterate, we are totally good with the local teams getting the records directly, which they don't now. So there's no objection to that at all. But what we're concerned about is just changing the language to immediate doesn't address some of the specific language that's in statute, even in the Child Fatality Review Program, that references this one section of the medical records that allows and protects both the program and the provider from sharing records between each other, because as you know, medical records, there's a lot of rules around medical records and how they can be disclosed and not disclosed. So we want to make sure that the local team can get direct access to the records from the providers but that they're also, the providers and the program have the same protections that both child fatality review and state program have when records are shared. And we're just not sure that the language is clear enough. There's some cross references that we think are missing, but I want to reaffirm on this meeting, it's not an objection to the records going directly to the local program, because we appreciate they may be looking at different factors in the state program. So we just want to help them get a bill that actually gives them the records, but also protects their use of those records and the providers when they're sharing information back and forth.
Thank you, Ms. Casemeyer. Delegate Alston.
Yep. So Ms. Casemeyer, where in the code is that located? Do you know where it is under the Medical Records Act?
Oh, you're on mute.
Muted, Pam.
I'm going to look at the markup. Thank you, Ms. Cranky did some draft amendments. They're technically probably not lettered correctly, but the language is correct. There's provisions in Title 4, Subtitle 3 of that article that the bill would say, from our perspective, would need to say that Title 4, Subtitle 3 of the article does not apply to disclosure made to the program under this title, because those are medical record protections under the state law and in child fatality review. Those sections of the medical record wouldn't apply to the program and the providers. It creates some exceptions, so they're allowed to share records, and that's not in this amendment, and it isn't in the current section of the local team. So we're a bit concerned that.
I understand. I'm just trying to narrow down where it is in the code so that we can add that protection to that section of the code. So that's what I was trying to get for the council. So she doesn't have to spend time looking for it.
The provisions of Title 4, Subtitle 3 of this article did not apply to disclosure made to the program under this subtitle.
And with that, would you all be satisfied with the language in the bill? Or is there another section that needs to be amended as well?
Yeah, and I think you want to make sure that all healthcare providers and facilities, so there's language that says a healthcare provider or healthcare facility is defined under Title 19, which subtitle, that's all the healthcare providers and facilities definition shall provide the local team with access to all relevant medical records. So it's a lot of technical language, but we didn't talk through it yesterday afternoon in a way that the city seemed to be okay with that.
I guess my point is we're already doing this somewhere else. So that statute and that protection is already there somewhere else. And we really just need to add this program to where it's already happening instead of trying to rewrite all of the protections that are currently there under this new statute. That's my point. So if you could get the information to Erin's, because I think she's going to be working on something. So we don't have to wait for you to talk to the city and the city to talk to you, for you all to come to an agreement on something that's already law. We just need to add this program to the protections that already exist. Thank you, Madam Chair.
Thank you, Delegate Alston. And we are going to have this back on the subcommittee list for Tuesday. So I would like consensus by Friday, which is tomorrow, so that we can, council can consider it Monday, so that we can have it for Tuesday. With that, Ms. Cranky, go ahead.
Thank you, Chair, and happy to work with Ms. Hopwood and the stakeholders. We met yesterday, and we have the reference Health General 13-1205, which just pulls from the state maternal mortality review committee's statute. So happy to work through that. Thank you for the opportunity.
Thank you very much. Delegate Hill.
Thank you. So I just want to say, I think that it sounds like that statute, what you all are proposing, needs to come in. And I also think that what the city recommended, changing immediate to prompt without undue. I guess why don't we get clarity? Does that language need to be changed as they suggest, or is it not necessary because of the current statutes to reference what time frame at all? And so I guess I'm asking Ms. Cranky to weigh in on that so we can be clear about what this amendment needs to do.
Sure. Thank you, Delegate Hill. In the state MMR statute, it says reasonable access, and the state MMR has a policy of 30 days. So having alignment between the state request and the local teams would be helpful for the hospitals providing records to both.
And from the proponents of the legislation, the sponsors, is 30 days sufficient? Because that's what medical offices tend to work under.
So Nina Themelis here with the city. So I think as my colleague Julia mentioned earlier, we're asking for immediate because we only become aware of the maternal death after the state has already completed its review. So it wouldn't cause any undue additional burden to the health providers because we will only be asking for those records after the state has already had them for more than 30 days.
So let me explain something. If I'm a health provider and I provided something to the state and I get a request from you, an attorney, or anybody else, I have to redo that. I don't have what I gave them sitting on the side. I have to pull those records and have my staff recopy them. So it is an additional, it's not having done it once doesn't mean it's done. So the same amount of time, whether it's a patient, an attorney, a commission, the state, it takes time to put those records together. And maybe that's the part that you're not clear about. It may not be additional time for the state to provide it, but it's additional time for the provider. They start over every time.
Understandable. And we wouldn't want to place any additional burden on the healthcare providers. So as far as immediate versus without reasonable delay, we're comfortable with that language.
Thank you. Ms. Casemeyer. You're on mute.
Sorry, I guess a question, because I'm still a little confused, because language required to say the state, when it gets its records, has to share them with the locals right away is different than requesting them directly from the provider. And I had originally thought that the city wanted to request them from the provider. That's sort of a different issue altogether. So maybe what the language should be is the state shall notify the local team when they learn of a maternal death. So some of this maybe it's a little more confusing even now to me than it was, because what I'm hearing from the city is a little different, because I didn't know that they wanted the state to share the records as a
They don't. That's that. Well, I think we keep going back to this confusing. I think the city is saying that the providers have already notified the state, but they're still asking for the records from the local providers. So we need to clarify that and not conflate this conversation further. I think we have our marching orders. We just need to find a way to make sure that everyone feels secure in those records, that we're getting the records from the providers to the local teams in a timely fashion, but that isn't overly burdensome with that immediate language, because to Delegate Hill's point, just because they've provided it to the state doesn't mean that they're just turning around and taking the same records and providing it to the local teams. So we have some work to do. I would like to be able to vote this bill out on Tuesday. I think you've heard from the committee, they would also like to vote the bill out today. So I'm holding it till Tuesday to provide you time to get to consensus. I'm also going to ask Delegate Lewis, who represents Baltimore City, to work with the stakeholders, because I know that you have, this is where you represent, and you're, this is very much in your wheelhouse as well. So if that would be okay, Delegate Lewis, if you could run point on making sure those meetings happen and getting us to consensus, I would greatly appreciate it.
Thank you, Madam Chair. I'd be happy to, especially since I introduced this bill in the past and had the same arguments. So I'd be happy to bring us to the finish line. So I look forward to speaking with everyone. Thank you.
Thank you, Delegate Lewis. With that, we're going to hold this bill and we're going to vote it on Tuesday. So please make sure we have amendments that are consensus so that we can vote it. Make sure you are part of that effort so that your voice is heard. And with that, do I have a motion to adjourn?
Motion to adjourn.
Second.
All right, thank you very much. I will see you all on the floor. You've got 10 minutes.
Thank you, everyone.